So our next presentation is all about scaling digital health innovations across Africa. And to make the presentation is someone who's a healthcare technical advisor for Mott MacDonald. They're a global development, management and engineering consultancy. And who better to give us an insight than Yara Aboelwaffa?
Good morning, good evening, good afternoon, everyone. Thank you for joining this session today. I'm Yara Aboelwaffa from Mott MacDonald Global Development Management and Engineering Consultancy. We're also part of UKAIMA National Membership Organization. Briefly in this session, I'll go through what is scaling up in the context of digital health, what's the current global situation, and just a case study that we've worked on to bring the narrative to life with some real examples. So scaling up is a hot topic. The development organizations are talking about scaling up, the tech industry is focused on scaling up, and one of the most important criteria to invest in a startup is its scalability. But what does really scaling up means? So there isn't a universal definition on scale. Some definitions focus on replication or adaptation of the processes, accelerated growth, geographical expansion, or scaling impact to match the level of the need. In the context of digital health, this is the definition that I like or kind of follow most, which is basically how can we get 100x of the impact with only 10x change in the size of the organization. And this is a definition I like most because if we want to achieve universal health coverage and the SDGs agenda by 2030, it's important to understand that it's impossible to do it using traditional solutions due to budget constraints, workforce limitations. We need to be thinking of solutions that can scale efficiently without the exponential increase in resources. So in that sense, scaling up is really important because investment in innovation, as shown in this graph here, only yields impact if an organization is able to master the scaling part of the process. So with a greater ability to scale interventions efficiently, we can start maximizing the return on investment. But given the intensity of the healthcare challenges that the world is facing today, funders from governments, international organizations, private sector, basically everyone has been trying to discover proven solutions that can be implemented quickly. And this is inspired by the technological advancements that we see in the world around us and the successes of the technology giants like Uber, Facebook, Airbnb, Instagram, and the likes that have scaled massively all across the world in a span of less than 10 years. So many of the founders are now trying to look for the next big thing in healthcare. And you hear a lot of innovators branding themselves as we are now the Uber of healthcare. But the thing is that unfortunately there is a tremendous gap between the expectations of the funders and the reality that innovators and change makers are making on the ground. So the resources, the ecosystem, prospects for growth at a company like Facebook or Uber are completely and vastly different than those available for those who work on, for example, a telemedicine solution to connect remote populations. So now we kind of stand at the crossroad. There is a lot of early stage ideas and successful pilots, but very, very few interventions have made it to a considerable scale that could really affect and impact at a large scale. And with that, a lot of organizations, a lot of researchers, universities has been looking at frameworks and guidance to develop digital health innovations and to scale innovations. Mostly what is present in the literature focus on social innovation rather than digital health specifically. The guidance includes like the principles for digital development, the strategy for to scale innovation by UNDP, the global public goods. Most of these frameworks are trying to bridge the gap between the successful pilots and how can you implement at a scale to basically have the impact that is needed. And when we look around the world, there are actually a lot of successful digital health innovations that has scaled massively and is impacting a lot of people. So we look, for example, at the Be Healthy, Be Mobile program, which is a multi-stakeholder program that is initiated by the WHO and the International Telecommunication Union and different governments and private sector partners, I think around 2012 or 2013, and still ongoing, which looks at providing guidance on implementing mobile health technologies at a national scale. And there's also like the flagship project in Rwanda, Zipline, that has been funded by UPS and by Gavi, working with Zipline, which is like a drone delivery startup company to deliver medical supplies to hard-to-reach health clinics. It started in Rwanda, and I believe it's now also scaling to Ghana. And Rwanda is really a beam of light now, and they also have a partnership with Babylon Health, which is a British health tech company. And the partnership included between Babylon Health and Rwanda government to use tools to analyze symptoms to determine the appropriate action that can connect patients to clinicians over the phone and can also help the staff within the health centers to prioritize the most urgent cases. But in reality, there is actually a lot of successful cases that we've touched upon. The reality is it is actually extremely complex. And if there is one thing that we've learned through the years working in scaling up digital health solutions is that there isn't really a silver bullet to develop and scale digital health. Broadly, I think there are three interlinked but moving parts to the equation to look at when we start thinking about how do we scale digital health solutions. First, is there a demand for the solution? Because there's usually an assumption that a need for a certain solution means demand, which is not the case. Investments go into building a solution on an assumption that people will automatically use it, which is almost never the case. Usually, one would need to factor in building a demand generation strategy, and that takes a lot of time. Another thing is the type of the digital health solution we're looking at, and what does scale mean for this specific solution? Relevant scale differs dramatically by the type of the digital product or service. So a health information management system is very different when you think about its scale than a medication adherence or a remote monitoring program. And another thing would be looking at the route to scale. So the route to scale would differ a lot based on the type of product. If it is a national birth registry, that possibly the only route to scale would be through the public health system. But if it is a wellness app to improve physical activity, it could potentially be scaled maybe through employers. But to be able to scale digital health solutions to its full impact, it needs to be institutionalized within the current healthcare system and moves from an innovation to a business as usual. So understanding how the healthcare system looks is critical. How is the service provision organized? Is it through public healthcare facilities? Is it a private? Is it a mixed model? And then who is paying for the services? Is it a private pay, public budget? Is it private health insurance, social insurance, or a national health system? So between those two critical parts that we need to look at when considering scaling, but both the digital health solution and the health system, they lie within the grander innovation ecosystem. The ecosystem for scaling looks beyond the digital health innovation itself and at the different actors within the innovation ecosystem involved or impacted by the innovation process. Broadly, this is how an innovation ecosystem for digital health would look like. It would include pharma, it would include service providers, it includes tech companies, it includes funders, investors, banks, it includes the government, the regulatory agency, the Ministry of Health, Ministry of Finance, Ministry of Education, it includes the universities, the R&D, and it would also include the innovation support ecosystem, so accelerators, incubators, competitions, and so on. So understanding how the broader ecosystem functions and understanding if this transformation that is happening in the market, is it government-led, is it market-led, or a response to a certain need, would help in understanding the elements and relationships and conditions that would either enable or impede scalability. Scaling would depend on different things. It would depend on favorable government regulations, availability of sources of investment, but it would most importantly uh, be dependent on an ecosystem where relations and trusts are cultivated between different stakeholders. Through the past years, we worked recently to evaluate scaling of different digital health projects in Africa. And one of the very interesting projects that we looked at was the Better Immunization Data Initiative in Tanzania. It's funded by the Gates Foundation. And the program looked at improving the quality and use of data for more effective immunization programs. So between 2013 and 2018, the program looked at rolling out immunization registry, data use interventions, and stock management solutions. Within the 5 years of the program, rolled out the package to more than 1,000 health facilities, and almost 500,000 children have been registered into the EIR. Yet, by the end of the program, there had not really been a full transition from paper-based to electronic immunization reporting. Currently, the electronic system runs alongside the paper-based legacy system due to infrastructure challenges, but also a variety of different issues. It kind of took time to adapt the current solution to the operational context of the health facilities in Tanzania, such as like building an offline functionality and operating within the current data bundle allowance. But generally, looking at the Better Immunization Data Initiative and other digitalization initiatives in low and middle income countries, there are a few lessons learned that emerge from that. So I think there is a bit of a technical issue moving the slides. Here we are. So first and foremost, understanding the lessons learned from this initiative and also from other initiatives, we see that there are some themes that emerged that needs to be considered when you're thinking about scaling a solution through public sector at a national scale. First and foremost, it's understanding from the very beginning the user needs, and not only the user needs, but the institutional and the governance setup of the environment, and factoring in the time needed to adapt and iterate the process, and also to bring on board the frontline health workers, which means being realistic about the cost of capital that is needed and the recurrent cost for the operations. But most importantly, the service or the products needs to contribute to the long-term national strategic vision of the context that we're working in. Finally, I think that there is no silver bullet to scale digital health solutions, but it will always depend on the context. It will depend on, as a recap, on which digital health product, or service are we talking about. It will depend on the health system that you're working within, public, private, or mixed, and it will depend on the whole innovation ecosystem, considering different factors like regulations, policies, investments, and the like. Well, thank you very much, and I hope you enjoyed the presentation. And looking forward to your questions. Have a good day.
And here is Yara now, joins us for your questions. Thanks for that presentation. It's a huge challenge, but there's lots of optimism, Yara, with the future.
Definitely. Hi, Dave. Hi, everyone who are listening to us. Yeah, I see massive challenges still in healthcare, but opportunity is there, and we're looking forward to it.
You mentioned there in one of your case studies, where perhaps two systems are working together, the tech system, the digital system, and maybe the paper-based system. Quite a lot of people have some anxieties around tech, don't they, for various reasons, whether it's, because they're elderly and they don't quite understand it, or they don't trust it, or they're worried about their data. How would you overcome those anxieties and get more people moving towards the tech solution?
I think there are two things here. So within the case study, can you hear me well, Dave?
Yes, we can. We can hear you very well.
So within the case study, we were talking about a health institution that was trying to roll out electronic immunization records. So they were trying to put it in all the health facilities within the system. However, due to different issues, so some facilities did not have internet, some facilities, their workforce was not really qualified enough. So it ended up having two parallel systems together, like the paper-based, which was the original system, and the new one. While this is a degree of success, yet understanding like the whole complexities around rolling out a national program for digitalization has much more complexities than the mere technology itself. But on the other side, on the question that you're asking, a lot of people are having anxieties or like tension around like moving towards the digital, a more digitalized system. And I think the main concept of digital is that it needs to be human-centered. And to roll out a proper digitalization program, it needs to be inclusive, specifically in healthcare. So if you're within countries that has much more older population, the tech needs to incorporate a user-centered design, which helps much older people to be able to use it seamlessly. And I think this is a big issue now, talking about how do you make tech inclusive for everyone and not leave anyone behind.
Yeah, and I guess that it's not just about raising awareness that the tech is available and perhaps encouraging people to move to the tech. I mean, in some cases, the old systems are phased out anyway, and all you're left with is the new system, and you've still got the fear. And perhaps there needs to be some training, do you think? I'm thinking of that older population who might say, well, I just don't know how to, download the app or log on. How do we overcome those challenges?
But also, it depends on who are we focusing on. Is it like the end user, so like the patient or the customer, or is it like the health worker user? Because these are two different users with very, very different profiles. From my point of view, the main concept is that the tech needs to be beneficial. Most of the problems that happened earlier because the tech was so complex that it was adding double burden on the health workers to be able to do their job. So now, like, I have the paper reports that I have to write it down, and then I have the online platform that I need to log everything in. So it kind of creates a burden. And within most of the programs that I worked on, I think most people are reasonable. If it's beneficial to them, if it makes it easier for them, they're willing to put in the effort. But there's also another side of empowerment. Most of what is blocking people is the fear that they won't be able to use it. So this kind of needs some encouragement and empowerment, and also some time for adaptation, knowing that if you put in a program now, not everyone is going to use it. People are going to have time, even like with like the Microsoft Teams, when like the whole companies moved from Skype to Teams, it needed like some time for learning, and this needs to be factored in.
And people need to be convinced when they say, well, actually, the other system was working perfectly well. Why do we need to change? So I guess that we need to convince and say to people it's a better system because, not because it's cheaper or because, it needs to be smoother and better. And presumably, Yara, we need to get feedback from those users, whether they're the end user, which is the public, or it's the person within the health service provider. If we're not getting feedback from them, then how will we know whether it's being accepted and whether it's working?
Yeah, and that's the first principle of like the design thinking. Empathy, trying to understand what the user wants, and having iterative cycles of development. So you develop it and then get feedback and then redevelop it again. But most institutions are kind of stressed with time, and they think if they can think of the perfect program and the perfect tech and just like force it on people. It never works.
No,
it's involved from the very first day.
I think there's probably an opportunity to manage control groups and get feedback that way. And you and I have probably filled in a form, whether that's online or in paper, or used a service and thought, well, I could do a better job of this. And often it's these people that provide them are too close to the action, aren't they, sometimes, that they don't see the wood for the trees, as we say sometimes.
Yeah. Agreed.
So you mentioned it's complex. We're hopeful, and there's already great examples of this working in practice. But surely in communities, in countries, across continents and across the globe, this needs some kind of coordination. Who's going to provide the coordination? Is that something for world leaders? Is it for the World Health Authority or the World Health Organization to coordinate?
Okay, so that's very, let's see where to start. So you have the healthcare system in itself. It traditionally used to be extremely segregated. So you have the hospitals on its own, the labs on its own, the dentistry on its own, like so many stakeholders only within a healthcare system of one country. The regulators alone, the payers alone. It was so fragmented. What happened, for example, and this is was a massive case in the US, is that the government said, okay, we'll provide hospitals with like incentives to start digitalizing. And then each hospital started having a different digital platform that are not interoperable. And now the US are trying to recreate this whole program. So I think the first layer of it is the different stakeholders within one health system. But then going beyond one health system, trying to organize a digital transformation in Africa, you have now not only the WHO, but a different of donors coming together, and now they have what they call like the donor alignment principles, trying to put together some principles on how do you start like the digital transformation space, what do they invest in, what they don't invest in, what are the priorities for each year, so that you can have like an alignment for investments and not repetition, and also things or products that can scale between one country to another. So and DHIS, which is like the health information system, it's a massive success case. like an open source platform that could be used across multiple countries.
And people, I mean, you talked about motivations there and incentives, but people, and it is down to people at the end of the day, whoever's representing the company or the government or the authority, come with their own agenda. And that requires real skill, doesn't it, on the behalf of the person that's trying to facilitate that discussion and that progress, is to make sure that everybody gets something in return. Because some will come with, we want to save money. Some will say, we want to make money. Some will say, all we're interested in is patient health. Some will say, no, we want to smooth the system. And that's a huge challenge. What's happening in that circle? You mentioned a couple of bodies there that are taking responsibility, but what else is being done?
I think, so that's the complication of rolling out a transformation of any sort, let it be digital or not digital. So when you're rolling out a massive transformation that is affecting everyone. It's affecting governments, it's affecting budgets, it's affecting the private sectors, investors, everyone. I think the key point here is the transformation is going to need time to align. The ideal is to have win-win scenarios. Because if you have one party that is insisting on a certain scenario that is not beneficial, it doesn't work. And that's the challenge and the beauty also of being digital, is that you cannot do things on your own anymore. You kind of need different parties on the table if you want to reach your ultimate goal.
Brilliant. And obviously the whole thing is about not just implementation, but scaling, which is the biggest challenge. And on your wonderful graph, you've got the graphic boom, which is, you know, that tipping point, isn't it, where things just take off, you know, and as you mentioned, you see it with platforms like Facebook and some boom and then quickly bust. How far away are we from boom?
Also one big challenge. So in the past 10-15 years, you had most international organizations and governments really focused in investing in innovation. But you have different stages of innovation. You have prototype, you have idea, prototype, early stage, or medium stage, and then you have a scale up. So scale up would be something with the size of Facebook and Uber. We're still, Uber, for example, the investors have invested $8 billion so that you have Uber with the size of Uber now. If you want to have a scale up of that size in digital health, then what are the numbers that we are willing to put as like a health system stakeholders? Is there that much commitment or that enough commitment to invest that amount of money? But also, is it wise to do that in one specific thing? So there is one challenge in investment when it comes to scaling up. But also, things are not easily replicable when it comes to healthcare because, like, of all the complexities that I was talking about within the presentation. And the other thing is that investment in early stage innovation is much more exciting than really trying to scale them up. Like the early phases is much more exciting. And so now we're thinking about, okay, exciting part is done. How can we move the pilots into scale-ups?
And I guess that begs the question as well. You know, there must be lots of practices out there, some good, some not so good. You know, do we have to improve best practice, particularly in low-income countries, to make sure that innovation goes to the next stage and then is then scaled?
Yeah. So I think one of the most important things is investments and fundings. And this is a big area where the scaling up doesn't really have much investment and funding, but also thinking about which innovations do you choose from the very beginning. So understanding how are you going to have a sustainable model. If you're thinking private sector, from the very beginning, before you get an investment, if you don't show revenue, if you don't show sustainability, you don't get investments. The situation with the international donors, which is working within like most Africa to fund digital transformation, it's a bit different. Not really focusing, or they need to focus on like business model and sustainability from the very beginning, and how this initiative is gonna have revenues and sustain itself for the long term.
And I guess some of the best ideas are coming from those people who are disruptors. You know, you mentioned Uber, you mentioned Airbnb. Someone sat down, didn't they, and said, you know what, there's got to be a better way of being able to get a taxi. Wouldn't it be great if a taxi could be tracked on my phone? Wouldn't it be great if that taxi then would take the money out of my account rather than me carrying cash? Someone disrupted what we would normally accept as the norm. And I'm guessing that's the same in healthcare.
Definitely. Within the private sector, within the low middle income countries, high income, there are massive innovations that are happening, very interesting, not only using technology, but really rethinking how do we access healthcare and what do we also expect from healthcare.
Yara, I could speak to you all day. You know, the level of interest and the questions, it's fascinating. The future, I think, looks exciting and bright. We have to be patient to get there. Be interesting if you and I were having this conversation in another 5 or 10 years and where we'd progress. But I suspect with people like you on board, we're in safe hands. Yara, thank you so much for joining us. Thank you for your presentation and for answering our questions today. Have a lovely day.
Thank you very much, Dave. Thank you, everyone. Have a good day.
Thank you to Yara there. And if you want to catch up with her presentation, you can watch it again on the Future Health YouTube channel. If you want to use the hashtag as well, Africa Health Week is where we are this week. If you use the hashtag either on Facebook, LinkedIn, Twitter, any of the social media platforms, you'll be able to pick up the conversation and see where we're heading. Remember, this is all about sharing best practice, innovation. It's about challenging ideas. It's about coming together with the idea that we're pulling together a healthcare community across the globe, that we can all have the same vision of improving healthcare and healthcare services. So that's what we're all about. That's what the series is all about. As I mentioned earlier, we've already had this event in the UK, in the Arab world, and we'll be moving to the USA and beyond in the future. But for now, we are in Africa Health Week, and there's plenty coming up this afternoon and across the next couple of days. We're going to take a break now for your lunch. We'll be back here in around about an hour's time, so join us then. But remember, you can use the platform to chat, to network. And of course, when we come back, you'll be able to see some more speakers and presentations, and you'll be able to ask your questions. So for now, we'll take a little break and we'll see you again shortly.